In this section, we're going to be talking about anxiety disorders. The different disorders in this category are panic disorders, phobias, obsessive-compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. The most important thing to remember about all of these is that it's an inappropriate experience of fear and worry that interferes with your daily functioning. Okay, so you have a decrease in functioning and causes stress or impairment. And this is really important to most psychiatric diagnoses. It has to cause stress or impairment for most of them to be considered a diagnosis. So the biggest thing, it has to be an inappropriate and decrease in function or cause stress or impairment. Sometimes there's a source of the stressor, sometimes there's not. It depends. Another important thing that in general, women are more prone to getting anxiety disorders than men are. So women is more than men. In specific, about a third of women are and about a fifth of men are, but in general, women are more than men. The next disorder we're going to be talking about is panic disorder. Panic disorder is pretty much characterized by these recurrent 10-minute periods of intense fear or discomfort. And usually there is a stressor, there is a context in which they feel these symptoms, which I'll go into for a second with this really long acronym here. But, so it's these 10-minute periods, and with all anxiety disorders, I'm going to stress, it's inappropriately high level of anxiety, of fear, and it interferes with their functioning, causes them lots of stress. So, as I said, it's described within a certain context, and it's also associated with persistent fear of having another panic attack. So, like if whatever context they go into gives them the panic attack, they're going to try to avoid that as much as possible. So let's go into this long acronym right here. So as I said, it's recurrent 10 minutes periods with 4 or more of the following. This acronym PANICS, and it's kind of drawn out because each letter, some of them have more than one meaning. I don't think it's really necessary to make sure you know all of these here, but I'm just going to go over it a bunch of times, and hopefully you'll kind of keep that in the back of your mind. But I don't think it's necessary to really remember all of these. But just let's just start from the beginning. So the first one is palpitations, paresthesias, this is abdominal distress, nausea, intense fear of dying or losing control, lightheadedness is kind of weird. It's lightheadedness. This is chest pain, chills, choking. This one is actually disconnectedness. That C stands for disconnectedness. And then sweating, shaking, and shortness of breath. So let me do that one more time. Palpitations, paresthesias, abdominal distress, nausea, intense fear of dying or losing control, lightheadedness, chills, choking, chest pain, disconnectedness, sweating, shaking, and shortness of breath. So you just need 4 more of those symptoms in that 10-minute period for it to be considered a panic attack. And I'll go over it one more time before we end if you missed anything. The other important thing to know about this is that there's a strong genetic component. Okay, so it's not something that just comes up sporadically, like if their mom had anxiety before and their grandmom had the panic disorder before, there's a strong genetic component there, so just keep that in mind. That's pretty important. And finally, the treatment for this is pretty much everything. So cognitive behavioral therapy, okay, this is for a lot of them, so that's like psychotherapy, and SSRIs, TCAs, and benzodiazepines. So SSRIs are used for pretty much everything. I mean, you can kind of just think of that. I mean, like a good number of them, except for maybe bipolar disorder, use SSRIs. That's pretty much a clear choice. Cognitive behavioral therapy, you can't really go wrong. And for a lot of these anxiety disorders, cognitive behavioral therapy is indicated just because you want to get rid of that fear using behavioral therapy. And TCAs and benzodiazepines can also calm you down. So benzodiazepines make sense if you have like palpitations and stuff. That's kind of like a sympatholytic. And then TCAs kind of goes with SSRIs there. So just remember cognitive behavioral therapy, SSRIs, TCAs, and benzodiazepines. And that is panic disorder. The next disorder we're going to be talking about is specific phobia. This is also under anxiety disorders. And again, this is something where you have an inappropriate experience of fear or worry, and it impairs your function. I really want to drill this in for all these disorders. It's inappropriately high amount of fear, and it interferes with your functioning, causes you a lot of stress in your life. So with this one, there's a specific cue. Okay, it's pretty easy. It writes specific, has a specific cue, specific phobia. So this is like fear of going outside. It's a fear of dogs. It's a fear of spiders. It's a fear of heights. Okay, specific phobia. And the important thing here is that you know that it's excessive. And I kind of want to go into this for a second. If you remember that there's axis 1 disorders, right, and there's axis 2 disorders, and the axis 1 disorders are kind of, this would be considered an axis 1 disorder because it's something that kind of comes about in your life, and axis 2 disorders are really the personality disorders. And in axis 1 disorders, it's ego dystonic, meaning when you have the disorder, you know it's bad. You know you're not you don't want that. In Axis 2 disorders, it's egosyntonic. So when they have this disorder, they're not thinking that the disorder is bad. It's just something they've been with all their life, so they don't actually think it's bad. So as anxiety disorders, as specific, well, not all anxiety disorders, sorry, but specific phobia, as it's an Axis 1 disorder, it would be ego dystonic. So they know it's excessive, they know it's bad, and they don't like it. Okay, and actually the way to treat this is actually SSRIs I think also work, but desensitization, sorry, is really important. So actually, if they have fear of heights, like slowly, going with them and maybe like over time, like gradually making them less fear of heights by actually having them do things. That would involve that. So that's one of the treatments. Under the specific phobia, there's a variant called social phobia. Okay, and this is fear. This is also called social anxiety disorder, but it's a fear of being in social situations. Maybe public speaking, maybe being in a small group of people, maybe it's using public restrooms, so something like that. And in that case, you'd want to use SSRIs. Remember I said SSRIs are just like the golden ticket for all these psych disorders, except for stuff like bipolar disorder. Okay, it's a manic thing, because remember, SSRIs and a bipolar disorder can actually precipitate a manic episode. So the next one that we're going to be talking about is obsessive compulsive disorder. This one's, I guess you could say, pretty famous or pretty infamous. Everyone kind of knows about this disorder, but it's not actually as easy as it seems. So most people think of obsessive compulsive disorder, they think of someone who's like really nice and everything has to be perfect and normal and organized and nothing astray or anything. But that's actually not really what it is. And obsessive compulsive disorder, that's actually when you have recurring obsessions like thoughts, feelings, or sensations that keep coming up, and it really distresses you. These things keep coming up, okay, and they're kind of hard to relieve, but you can relieve them by doing it. So, for example, if you have OCD with washing your hands, okay, like you always have to wash the hands, and the only thing that relieves it really is washing the hands. So that would be obsessive compulsive disorder. And the thing I said before, so a lot of people confuse obsessive compulsive disorder with obsessive compulsive personality disorder. Okay, so obsessive compulsive disorder is Axis 1, okay, and obsessive compulsive personality disorder is Axis 2. Because that's a personality disorder. So the obsessive compulsive disorder is when you just have recurring obsessions, and a lot of the times these people will be messy. If you go to their house, like their house might be really messy because they just have these obsessions and compulsions that they really need to do. And as I said, Axis 1, right, it's ego dystonic. They know it's bad, okay? They know that it's not what they want to do. And so as I was saying, the other one is obsessive compulsive personality disorder, and this is one where this person maybe their shirts are meticulously arranged in their closet, or like their utensils are perfectly organized within their cabinets or whatever. That's obsessive compulsive personality disorder. And since that one is Axis 2, that's actually egosyntonic, so they actually don't care about that. But for OCD, they can be messy, obsessive. It's just obsessions and compulsions, and it's ego dystonic. And this disorder is associated with Tourette's disorder. And you can kind of think that maybe it's like, Tourette's maybe has to do with like messiness and stuff like that. And I think it's a pretty easy association. Finally, remember I said SSRIs, golden ticket, there you go. Here it is for obsessive compulsive disorder. And the other kind of high yield one is clomipramine, and this is a TCA. If you remember, it's like imipramine, and so this is a specific TCA that's actually used for obsessive compulsive disorder, so that's something important. So you're always going to remember the SSRI, right? If you see the SSRI, yeah, you'll pick that. But if that one's not there, they might have clomipramine there, so the TCAs are pretty important. And not just TCAs in general, clomipramine is a big one. The next disorder I'm going to be talking about is post-traumatic stress disorder. This one's not too hard. Honestly, the biggest one for this one to remember is the time frame to just remember, but in a nutshell, it's just recurrent re-experiencing of a traumatic event, whether it be like war, rape, robbery, serious accident, or fire. It may involve nightmares, okay, and flashbacks with fear, helplessness, and horror. This is all pretty obvious.